What is aesthetic flat closure? So this refers to when a patient undergoes mastectomy, they may not want to reconstruct the breast and instead just decide to go flat. But there are nuances to this, and it is a technical skill to be able to get a nice flat result without lumps or dog ears, as we call them. So this is interesting because in the past few years, we've really seen leaps and bounds in the field of breast reconstruction after mastectomy, which is a wonderful thing. A lot of work has been done to make sure insurance will cover it if a patient decides to move forward with it. But it's not for everyone, and some patients will decide to just go flat after surgery instead. There's lots of different reasons patients may decide to do this. They may just want the simplest treatment possible and avoid undergoing multiple surgeries. They may not want the foreign body or an implant in there, and it is their decision. And in fact, about 44% of patients who undergo mastectomy may want to go flat after surgery. So there's a very interesting phenomenon out there which I have definitely seen patients encounter, and that is flat denial. And so basically what that means is that when a patient requests to go flat, sometimes a provider may intentionally go against their wishes and, for example, maybe leave more skin in case the patient changes their mind in the future. Now, if you leave behind extra skin without planning to do a breast reconstruction, this can leave a pretty unnatural look. And so the patient will have maybe sunken in areas, lumps and dog ears and things like that. And so in the past, I've had patients come to me who that has happened to, who want a smoother result after their top surgery and even can have issues with chafing or the lumps rubbing on their clothes or difficulty with hygiene. So it is really important to know. And in fact, in one study, 1 in 20 patients, so that's 5% of patients who wanted to go flat after mastectomy, were intentionally denied that. So more awareness needs to be brought about around this field. So flat closure is something I really specialize in my practice because a lot of my patients come to me for gender affirmation surgeries. So over the years, this is something I've really focused on, done thousands of these closures, and we're able to do it with a drain-free technique. But one thing my patients have definitely taught me over the years is having options is so important. And so not every patient will want to undergo a breast reconstruction, and therefore we have to have excellent techniques in order to do an aesthetic flat closure after surgery. Lots of different ways to do this. In my practice, oftentimes I see patients who come sometimes even years after the initial mastectomy in order to treat lumps and unevenness in the chest. And this is very possible to do a revision aesthetic flat closure. There are plenty of good resources out there. Over the past few years, we've seen a lot more awareness about this. It is a great choice if a patient is happy with that aesthetic after mastectomy. And as providers, we definitely need to be more aware of it and respect our patients if they choose to do that, respect their decision.